Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Steps to apply a compression bandage. A compression bandage is a type of stretchy bandage that is wrapped around a body part to place pressure on it. It is commonly used in first aid as part of a therapy known as rest, ice, compression, and elevation, and helps to reduce pain and swelling by restricting blood flow. /r/n/r/n These bandage wraps are typically used to treat sprains and strains. But, they can also help to keep a body part stabilized, such as when there has been a rib fracture. The bandages may be used to prevent or treat the buildup of fluid in the lower legs, known as edema. /r/n/r/n Illustration by Cindy Chung for Verywell Health/r/n/r/n Compression bandages can be anywhere from 2 inches to 6 inches in width. They are common items in a first aid kit. As a general rule, the wider the bandages, the less likely it will cut off circulation. It is important, therefore, to select the right size for the body part. /r/n/r/n By way of example, /r/n/r/n If the bandage wrap is cutting off circulation, you may feel swelling, numbness and tingling at or below the site. The skin color also may appear bluish or purple-red. You'll need to loosen the wrap to restore circulation. /r/n/r/n Always choose the right-sized bandage for the body part. A too narrow bandage can cut off circulation, while a bandage that's too wide may not provide enough compression. /r/n/r/n When using a compression bandage, you need to apply the right amount of pressure to prevent swelling and help stabilize the injury. This can be tricky since body parts and the blood vessels that supply them differ in size and shape. Wrapping a thigh is one thing, wrapping a complex joint like an ankle or wrist is another. /r/n/r/n The bandage should be tight enough to feel snug but not so tight as to cause pain, discomfort, numbness, tingling, or cold or blue fingers or toes. These are signs that the bandage is too tight and needs loosening. /r/n/r/n To use a compression bandage on a leg or arm. /r/n/r/n To use a compression bandage on an ankle. /r/n/r/n To use a compression bandage on a wrist. /r/n/r/n Don't be afraid to ask for help if you don't know how to use a compression bandage. If in doubt, call your healthcare provider to show you how to use one. /r/n/r/n Compression bandages do a good job of keeping the swelling down. However, there's a limit to how long you should compress an injury. At some point, blood flow needs to increase to encourage healing. /r/n/r/n To improve healing and prevent injury, there are some do's and don'ts you should follow. /r/n/r/n Use a compression bandage for only the first 24 to 48 hours after an injury. /r/n/r/n Combine rest and elevation with compression whenever possible. /r/n/r/n Remove the bandage at least twice daily for a few minutes before placing it back again. /r/n/r/n Ask your healthcare provider if you should sleep with a compression bandage on. If so, loosen it a little bit before bed. /r/n/r/n Don't apply ice and compression at the same time. This can cause frostbite. /r/n/r/n Don't wrap elastic bandages too tightly. This can cut off circulation. /r/n/r/n Don't use a compression bandage to prevent re-injury. The bandages can help stabilize joints, but they neither support nor protect them. /r/n/r/n Never use limp bandages. Washing the bandage can help restore some of the elasticity. Buy new ones if needed. /r/n/r/n Compression bandages are extremely useful but not appropriate for all situations. There are several alternatives that may be better suited for certain injuries or medical conditions. /r/n/r/n Bandage wrap is appropriate for initial treatment of some injuries, but not all of them. If an injury causes extreme pain, a visible deformity, a locked joint, severe bruising or swelling, or the inability to stand or walk, see a healthcare provider. /r/n/r/na compression bandage is a long strip of stretchable cloth that you wrap around a sprain or strain to apply gentle pressure. By restricting blood flow, swelling and inflammation can be reduced. This not only promotes healing but helps to make the injury feel better. /r/n/r/n It is important to use a compression bandage correctly. This includes choosing the right size and wrapping the body part snugly to apply pressure without cutting off circulation. A compression bandage generally should be used for only 24 to 48 hours after an injury. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.